I am going to talk about now the very basic foundation of our craniosacral therapy, and that is craniosacral rhythm. The cranium means the skull, the sacrum is the pelvic bone, and the vertebrae in between. They form the craniosacral rhythm. Now this is our cranium, the skull. I'll go to in detail about it later on, but this is how the skull looks like. It is made of various different bones, like 8 bones, which are close to each other and which look like they are fused or closed. But if you look here, they are not exactly closed. There are joints joining these bones, and they are called the sutures. Sutures means the junctions of the bone. And similarly, if I take to the sacrum or the pelvis, this is the model of the sacrum or the pelvis. This bone on the back, on the lower back, is called the sacrum, and these two are called the iliac bones, and together this is called the pelvis. So this sacrum between the two iliac bone is there. These all are moving. They are all having the movements, pulsatile rhythmic movements. These cranial bones, the bones of the skull and the sacrum down, is moving, expanding, contracting, going away from each other, coming close to each other. And this going away and coming close, going away, coming close movement is called craniosacral rhythm. When these bones move apart, go away from each other, this is called flexion, and when they come in, it is called extension. This is something that we have to very clearly understand, that the bones of the cranium and the sacrum and the body are rhythmically going into outward rotation and inward rotation. Outward rotation flexion, inward rotation is the extension. Flexion, extension, flexion, extension, expansion, contraction. This is the basic thing that we have to very clearly understand, practice and feel in craniosacral therapy. The normal rhythm of the craniosacral system is normally 6 to 12 per minute. If it is more than 12 or less than 6, it means there is some problem or some issue. If it is very high rhythm, it means the person is very hyperactive, or there is something going on in the system, or the craniosacral system have been very activated because of some infection or some disorder. If it is very low, it means the system is underactive. This is something we have to very clearly understand. And in our session, the first thing is we tune into this craniosacral rhythm, the flexion and the extension, and then we learn how to stop this rhythm for a few seconds, and this is called a still point. Still point means the rhythm that is happening stops, and when it stops, the system undergoes a deep resetting and it reorganizes, it undergoes a deep healing. So still point are very, very therapeutic and they heal themselves. So this is something about craniosacral rhythm and the still point. Another thing, after the still point, the rhythm, the craniosacral rhythm becomes much better, much stronger and much more symmetrical. When we are tuning into craniosacral rhythm, we have to look into 3 things. Are the right and the left rhythm equal or unequal? Is one stronger as compared to other? This tells us which side the restrictions are there. Suppose the right side has a strong rhythm, the left side is a restriction, that means the right side is free, the left side has restrictions, right? So we call it the symmetry. Is the right equal to left or not? The second we look is the amplitude. Is the rhythm strong or is weak? If it is strong, it means that the condition of the body is good, the status of the energy level of the person is very good. If it is a weak rhythm, it means the person is tired, the level of energy is less, and the system is more prone to disorders and disease. So this is 2 things, and one is the symmetry, the second is the amplitude, and the third is the rate of the rhythm. At what rate is the rhythm? Is it 6 minutes per minute? Is it 12 per minute, or is it more per minute? This is what we come to know. In the other versions of craniosacral, we also talk about mid-tide and the long tide. I will talk about it in my further videos when we talk about the biodynamic approach of the craniosacral therapy. So thanks, this is about the craniosacral rhythm and the still point, and now I will show you this step on the patient, on the client. Thank you.
For latest updates, click on the bell icon and subscribe our channel.